Thanks for coming down. Today, I'll be sharing on Nocturia in older adults. It's a big term, but essentially what it is I'm sure a lot of us may worry about passing urine several times at night, and it will definitely affect quality of sleep and cause other complications as well. And today we are here to talk about what are the common causes, and also what are some simple tips that we can do to help reduce this issue. Yeah. Okay. So you can ask yourself these questions: do you spend more time at night in the bathroom rather than in your bedroom? Do you wake up over and over again, to pass urine? And is it bothering you, right? And some of you may ask, is this part of aging as well? And this is actually what we call nocturia. So what is nocturia? It is the need to urinate, more than once at night. And just bear in mind, nocturia is actually a symptom of other conditions, and it's not a disease in itself. So at the end of the day, we do want to find out what is causing the nocturia, and then we treat that problem accordingly. Okay, so how common is it? So about 50% of all adults over the age of 65 can get up at least once a night to void, and about 24% of these older adults will have 2 or more episodes every night. And what are the reasons behind some of this? So as we age, some of us will have reduced bladder elasticity, reduced capacity as well, and therefore reduced ability to store our urine at night. There's an increased risk of urinary retention after every time we pass urine as well. And in women, right, sometimes we can have other problems such as weakened muscles or even things like falling out of the vagina, what we call prolapse, that can cause these urination problems. Some females can, after menopause, can have low estrogen levels as well, leading to what we call atrophic vaginitis or dry vaginal area, and that can also irritate the area and cause urination problems at night. In the males, we are also not spared. We have prostate gland, and there can be enlargement of the prostate itself over here, and then that itself can also cause urine problems. So, what are the consequences, of passing urine several times at night? I think quite clearly, disturbed sleep is one of them, and up to a third of the older people, they may not be able to go back to sleep after urination, and can cause problems of insomnia. It not just affect the person, but your partner as well, your partner's sleep. And in the older adult, of course, if let's say you keep on going to pass urine at night, it can increase the risk of falls also. So those are all the so-called complications of nocturia. However, there are treatment options. There are things that we can do to help reduce it. So broadly speaking, I'll be talking about modifying our behavior, as well as possible some medications as well. And hopefully with changes in our behavior and these medications, we can reduce the risk of nocturia, and then reduce the risk of falls, etc. Okay, so this is a very busy slide, but I think it's mainly to drive home the point that indeed this problem it can be multifactorial. There can be many reasons causing urine problems at night. Okay, so broadly speaking, I'll divide it into like urinary causes and non-urinary causes lah. So for the urinary causes, as mentioned before, as we age, the bladder capacity, reduced elasticity, so we may not be able to store urine as much. Some of us, for the kidneys, there may be an issue of making too much urine at night. So all of us secrete this hormone at night to help us reduce the amount of urine actually, and that is also dysregulated in older people. And of course, environmental causes lah. So those are urinary causes. But how about the non-urinary causes of this issue? So actually, broadly speaking, things like issues of the heart can also cause nocturia. So if let's say you have some heart disease, you have heart failure, and you have things like leg swelling as well, it can lead to increased stretch of your heart and lead to increased hormone production, causing more urination at night. So then if that's the cause, then perhaps treating the heart issue itself will help with your urine. The other thing is, if let's say you have kidney, chronic kidney disease, disorders, it can also cause urinary issues. If you have neurological disorders, so for example, things like Parkinson's, dementia, for example, it can also lead to increased risk. Other things would be things like your endocrine problems. For example, if you have poorly controlled diabetes, then you have a lot of urination, sometimes both in daytime and nighttime as well, and that can be a cause. Some of the symptoms is things like feeling excessive thirst, or what we call polyphagia, like wanting to eat a lot as well. So those are features of diabetes. If let's say you have thyroid problems, sometimes you can also have urine issues. Other things would be pregnancy, menopause. Yeah. Sleeping disorders, if let's say you have some, actually the most common thing that we look out for is this thing called obstructive sleep apnea over here. So obstructive sleep apnea is a condition whereby you may notice that you or your partner snores a lot at night, or you get early morning headaches, or you have very poor sleeping quality at night, and leading to daytime you feel very, very tired, you sleep a lot, and it may also cause issues in your day-to-day work as well. So that one is, it could be obstructive sleep apnea, and that itself can also cause urine problems at night. So in summary, I think if let's say you do have uncontrollable urine issues at night that is bothering you, I think it's reasonable to speak to a medical professional to really evaluate what is the underlying cause of the issue, and treat accordingly. Okay, medications itself can also cause urine problems. We do know that as we age, we get more medical issues. We are starting on more medications. Medications itself, they are beneficial, but it also causes harm sometimes, right? And some of the medications can increase the amount of urine production, or lead to leg swelling, and then it can cause urine problems. So examples will be things like diuretics. So this thing called furosemide. So for example, if you have a heart failure problem and you need to be on medications to reduce the amount of urine, water volume in your body, doctors may give you this. This in itself may cause urine problems at night. So then it's advisable to instead take it in the morning rather than taking it too late in the afternoon. Certain blood pressure medications can also cause urine problems, and caffeine itself as well. So what can you do to help yourself? So I'll go into each of it. So number one is avoid bladder irritants. I'll go into more of examples of this later. And then before you sleep, try to limit the amount of water that you drink 4 hours before sleep, so that you don't keep on waking up at night to pass urine. And if let's say after you wake up from your sleep, try not to take more water. Otherwise, it's quite logical, right? You will just pass more urine afterwards. Other thing would be edema management. So as mentioned, if you have things like leg swelling, due to the hormones in your body, you may have more urination at night. So if let's say you have lower leg swelling, discuss with your medical professional, your doctors. If let's say it's due to things like vein problems, you may just either wear stockings or elevation at night. That may help. Avoid diuretics. So as mentioned just now, certain heart medications can cause increased urination, such as furosemide or thiazides, and try to take them in the morning instead. And number 6 is sleep hygiene. So this is just a table of examples of how to maintain your fluid hygiene and what are the potential drinks that can irritate the bladder. So top are the drinks that probably won't irritate the bladder, and the bottom are food and drinks which can irritate the bladder. So things like tea, coffee, hot chocolate, green tea, etc. I think this is not meant to tell you like, oh, you cannot drink coffee, or oh, you cannot drink hot chocolate, because where's the joy in life, right? If you don't indulge in some of this sometimes. But I think what's important is if you know about this, potential bladder irritants, and if you do have urinary issues, then you might want to consider cutting it down, right? Maybe 1 cup a day, or maybe keeping it to the daytime, right? And try not to drink this after lunch, or definitely not during dinner time. Yeah. So so you can take a picture and remember it lah. And then the other thing is I think we also have to balance between drinking enough water and also don't drink too much lah, right, at night. So do try to maintain your hydration status. So in this chart, you look at the color of your urine lah. You try and aim for maybe 1 to 3, a bit more pale, so that you're well hydrated. And you try to hydrate yourself in the daytime, right, to avoid issues at night. The other thing is edema management. So as mentioned, right, because if let's say you have lower limb swelling, and at night, there's increased blood flow back to the heart, it causes a stretch, releases a hormone, and then you pee more at night. So then you also want to manage your leg swelling issues, like if you have it. So simple things like elevation of legs, compression stocking, or simple exercises to get your blood circulation moving would be very helpful. Just a small point for compression stocking, if let's say you do want to try, you can aim for about 20-30 mmHg compression. If let's say your doctor told you that you have artery problems in your legs, your peripheral vascular disease, for example, then you will probably want to be cautious in using compression stocking, because you do not want to exacerbate your other vascular problems. Yeah. Okay. Then the other important thing is sleep hygiene as well. Simple things like your bed is a very important place at home. Try not to lie on it unless you're feeling sleepy. So some people may have a bit more of a bad habit. Even though they don't feel sleepy, they just lie down there, for example. So try to keep yourself active, and then when you know that okay, this is my sleeping time, then you go to your bed, and then try to have a regular sleep schedule, all right? And then before you sleep, of course, try to reduce your screen time as well, because our phones, television, or computer, they may have the blue light, and it may also lead to poorer sleep at night as well. Before you go to bed, you can try going to the toilet to empty your bladder, right? And then for exercises, maybe you do it early in the morning, and things like sleeping in a warm bed. I think this one plus minus Singapore environment, all right? Okay, so if you do wake up to pass urine at night, not to fear. So I think the other thing to take note is safety precautions when you're at home, especially if you're with a loved one that is very elderly, poor vision, poor hearing. The risk of falling is actually quite high. So you will perhaps want to have lighting at home, like things like yellow lights, low-level lighting, and you'll want to remove any obstacles from the bed to the toilet to avoid tripping over. The other method is if, let's say, the distance to the toilet is very long, right? You don't want to rush to the toilet. You can consider purchasing a commode or a bedside urinal, so that you don't have to walk all the way to the toilet at night. You just pass urine near your bedside, reduce the risk of falls. Okay, so those are some of the conservative methods. This is another one, there's this bladder retraining, which was also touched upon in the other talk just now as well. Especially, if let's say you have overactive bladder, for example, you can consider bladder retraining. So what we advise is you try to empty your bladder as soon as you get up in the morning, and then at daytime you're trying to create specific times to go to the washroom. And at night, only go to the bathroom if you are awakened and you find it necessary. So how bladder retraining works is that you kind of train your bladder to slowly retain more and more urine. So for example, if let's say you set maybe every 2 to 3 hour frequency to pass urine, if let's say you feel the urge at the 1 hour mark, then you can use some urge suppression technique or relaxation technique like deep breathing exercises, and try to suppress the urge, and then you just try and lengthen, the duration of your urination, and then try to establish a schedule as much as you can, and how to increase your chances of a successful bladder training is also you can also do pelvic muscle exercises daily as well, to help you maintain your bladder frequency. Yeah, so by exercising your bladder and pelvic floor muscles, you can help to control the urge to urinate. And bladder training is effective for many women as well. So try and stick to a schedule and give yourself time to relearn when to respond to a need to go. And when done correctly, you can also combine it with pelvic floor. Pelvic floor exercises can also help you to reduce and stop urine leakage as well. And if let's say you are not too sure what you're doing and whether you're doing it correctly, do speak to your doctor about it and consider referral to pelvic floor physical therapist. So thank you.